dangerous vitamin deficiency is a thing of the past.
I definitely remember myself feeling, oh, here's another placebo that people are just doing because they want to make themselves perfect.
But this widely held and erroneous assumption about B12 can be a serious problem, as pediatrician Dave Carr found out in 2005 when he became the patient.
I had no reason to suspect that anything out of the ordinary was going on other than that I was getting older. I also remember rounding at the hospital, and on several occasions I almost tripped. I guess we would call it foot drop, where the front of my foot went down when I was bringing my back foot forward, and I stumbled, and I did it twice while I was rounding, and I remember saying to myself, boy, getting old is sure a bear. Then I started noticing a little bit of loss of balance. At that point, I called an ear, nose, and throat doctor friend, and I questioned him about my equilibrium and thought that maybe I had a problem with my balance in my ear. He said, Dave, I don't think that's what it is. I think you need to see a neurologist. Several weeks later, I was in the office of a well-known neurologist, adult neurologist, and at that point he suspected that I had a condition called multi-system atrophy.
And the results came back that were just absolutely devastating. And the olivopontocerebellar atrophy is a death sentence.
By June of 2005, I was basically confined to my house in what my son calls my sleeping chair.
He was functionally blind. You would have to scream at him to be heard. He could whisper.
I remember having panic attacks. I remember my friend, the same Dr. Harvey Barnett, standing by me. My best friend's wife informed me later on that she went to one of my doctor's visits with me, and that my neurologist said to her, why don't you just call hospice and make him as comfortable as possible?
He was rolled up in a fetal posture. His hands were retracted. His thumb was in between his ring finger and his middle finger. He was shaking uncontrollably, and it looked like he was freezing. He had lost probably 30 pounds.
I yelled at him, why don't you just let me die? And he said because he couldn't. He put me in his car and he drove me to Shands Hospital in Gainesville, Florida, where I was correctly diagnosed with a vitamin B12 deficiency.
Dr. Carr was immediately started on aggressive B12 shots. Within 3 weeks, he began physical therapy with the friend who saved his life.
I returned to the office in March of 2006 in a wheelchair. I have since weaned myself off the wheelchair, and I am the most stable on forearm crutches. I learned a saying in medical school, when you hear hoofbeats, look for horses, not zebras. I think that most doctors, including myself, consider B12 deficiency as a zebra.
To know that this, in fact, was the proverbial horse and not a zebra, I felt personally responsible for missing this.
If my best friend had never picked me up, taken me to Shands Hospital where I was correctly diagnosed, I'm sure it would have gone down that I had died from a neurological condition, ignorance. I don't know any other way to explain me not thinking I had a vitamin B12 deficiency.
Patients can have severe neurologic damage without any telltale sign of megaloblastic anemia. To confuse things more, they can also have damage in the outdated, so-called normal range of serum B12. Eventually, the toxic metabolites homocysteine and methylmalonic acid will start to build up in a person who does not have enough B12. All of these tests might have to be done to rule out a deficiency.
My doctor never did the vitamin assay.
His methylmalonic acid is up here, and his vitamin B12 level is down here. This is lethal. This is lethal.
Knowing what I know now, yes, it seems very odd that B12 levels are not routinely checked. I can only assume that it happens much more commonly than we would have ever imagined.
I think we don't think about B12 deficiency enough in the setting of neurologic psychiatric and cognitive disorders.
What I see is a kind of indifference and sometimes an attitude of condescending indulgence. Oh, there he goes on about B12 again.
A patient who is in a high-risk group, I would test. And by high-risk groups, I would include people who are on a vegetarian diet. I would test in people who had intestinal dysfunction, suggesting malabsorption, particularly problems with the stomach. Problems with the stomach include ulcers, not so much because of the ulcers, but because of the medications people take to treat those ulcers.
Proton pump inhibitors, Prilosec, Prevacid, Nexium, and physicians are prescribing that like candy to them.
People who were on the proton pump inhibitors were more likely to be deficient in B12 than the people who were not. Any patients with a vegetarian or vegan diet or who don't eat a lot of red meat should be checked. I think any patients who complain of fatigue, paresthesias, numbness, tingling, any problems with balance, memory issues.
I don't remember the point that I stopped remembering things. I'm not sure if I remember a lot of the things that I've relayed to you today, or if I remember them because someone told me about them.
And he was very ill. And they thought he had leukemia, and it took him a month to figure it out. He was at Henry Ford Hospital in Detroit, and they figured it out that he did not have leukemia.